Good evening, everyone, and thank you all for attending. Today we have a kickoff session, as I call it, with an amazing person who is going to walk us through the psychology of everyone that we're treating as physicians. And a lot of you are out there joining the forum today. My name is Shahina Dawood, and I'm a consultant medical oncologist at Mediclinic City Hospital in the United Arab Emirates. And I'm joined today with someone that I've actually met only once in person a couple of years ago, and we hit it off. And I think we've been communicating a lot on WhatsApp, on Zoom calls, and on emails. And you helped so many of my patients that I thought it was very important that we have this discussion today. Cynthia, I'm going to let you introduce yourself to everyone.
Okay, thank you so much. I'm so happy to be here, and thank you for inviting me. And I am amazed how you're in Dubai and I'm here in the United States, and we can hear each other clearly and we can communicate. I'm so excited to be a part of your kickoff. And I think the patient advocacy and awareness is so important. So thank you. And I am an oncology dietitian and also a health psychologist. I've been working in the field of oncology for over 35 years and enjoying every moment of it. It's something that's very important to me. I've enjoyed so much working with all of Dr. Shahina's patients and a number of patients over the years. To me, what's most important we're going to talk about today is your experience of the cancer. And we'll be answering a lot of questions that you have or discussing ideas that you have as well to cover diagnosis all the way through treatment, rehabilitation, and even afterwards, because even after you complete your treatment and move on, there's a lot to think about. So if now is a good time, I might share a screen just to show a couple of slides and then we could start our conversation.
Yes, please go ahead. Go ahead.
Okay, great.
And I'd just like to remind everyone that if you have any question at any time and you want to voice it, please raise your hand and someone in the background will unmute you so you can discuss, or just please post your question on the chat box.
Okay, is that visible for everybody
Yes,
then?
yes, yes, it is.
Okay, so let me just click in here. There we go. So health psychology for cancer patients, patient advocacy forum. And basically what this is about is your experience of cancer. What would that mean? All of your feelings, your thoughts, your perspective, how it changes you, how it changes your life, how you adapt to cancer as you go along. And in that way, you're experiencing something. So I believe firmly that the patient's experience will affect the outcome. I think that's how important it is that, you know how you feel and you take care of yourself, your emotions, your relationships, even your knowledge and understanding of your cancer can be very important. And this is how, just beginning with the diagnosis, even some people are naturally in a healthy denial. And I call it healthy because at first you think, no, this can't be happening. That's very normal to think that. Eventually, you might move into more acceptance, but you also might be completely surprised by the diagnosis. Some people are a little angry about it. Some are just completely numb. Some patients tell me they kind of expected it because maybe it's something in their family. The point is, as we go along and evolve through the cancer diagnosis, eventually you move into getting away from the why is this happening to me, which is natural, but more into how can I help myself? What can I do? What do I need to know? And then you begin to become a partner in advocating for yourself and partnering with your physician. So that first phase, I like to call the information gathering phase. Unfortunately, sometimes if you start to get on the internet and Google, you might not be finding the best information. That's why it's always so important to know where to go for good information. But yes, it is important to have some knowledge and some interest in even your cancer treatments that you'll be undergoing. And then after that, it's all about communication with your friends and family, who you share it with, how you share it, definitely with your doctor, who is pairing all the medical technology with the human factor, which is you and your experience. So those get paired up That's where all your hopes, your fears, even the things that you believe in become very paramount to your partnership with your doctor. And sometimes we even start looking at how we are talking and communicating to ourselves. Are we encouraging ourselves? Are we actually taking care of ourselves and making sure that we're looking at our track record, our ability to cope? I'm going to leave it right there for now because I'm probably already, this is getting some interest and some ideas. There's a lot for us to talk about today. So I'd love to hear any questions or ideas that anybody might have come with already.
So Cynthia, I mean, I love your slides, and I like the way that you've sort of laid everything out. And as an oncologist, just seeing my patients for all these years, and I know we have a number of surgeons and oncologists that are also online today. The way I see it, it's sort of divided into three aspects, right? So it's at the time of diagnosis, how to cope with that. Then during the treatment journey, the tools that you need to cope with that. And then I always say the toughest part of the journey is actually after everything is finished, because that's where you start to think, what if it comes back? So before we get to that, I wanted to focus on the first part. You had such a nice slide right at the very beginning where there's denial, there is anger, there is all those questions that come into your mind. But you said after that, then you have to grab hold of yourself and say, okay, how am I going to deal with it? I find sometimes patients aren't able to get to that point. They're just in continuous denial and anger. What should they do to be able to get to the next phase?
That's such an excellent question. And it's true. Any one of us could easily get stuck right there at the point of diagnosis. For one thing, it can be so shocking that you really haven't gotten past that aspect of the diagnosis, just how it made you feel. Often you need to repeat that story again and again, repeat what happened, how it was discovered, what the doctor told you. Usually underneath that is a little bit of fear, excuse me, based on not understanding completely what the diagnosis is. And sometimes I think it's worth speaking with somebody about exactly what is cancer, what is the biology of it. It is my own body, what's actually happening here, but also getting together with people who have gotten past cancer. This is a really important time to talk with someone, not who has negative stories, but somebody who says, I have been through that treatment that you've now been told you need to take. I am a survivor of that type of cancer that you have. That's a really good time to either seek someone out like that, or there are plenty of websites where you can be partnered up with somebody. I think that's really key, because if you can't mobilize yourself away from the denial, you may not get engaged in what you need to do. For example, a person in denial may not drink the water they need to stay hydrated. They may not take the medications in the proper way. They may not really slow life down. I've seen some patients go as hard and fast in life and miss appointments, even not make it to everything they need. In that case, you're hurting yourself. So I think somehow really sitting with it, looking at your emotions, finding someone to help you move past the denial, acceptance. Who wants to accept illness? Well, when you can accept reality and have the tools to now deal with the reality, that's when you can accept it. So you have a trusted doctor, you have nurses, you have lovely family, friends, etc. That's when you start to say, I think I have the tools. And I myself have overcome things in the past. I've overcome other challenges I've had, maybe even illnesses I've had, maybe even some tragedies in my past. You begin to notice you have a toolbox, you have coping skills. That all will help to move you away from being stuck and not accepting the diagnosis. And I promise anyone who gets stuck there, when you do move into acceptance, a type of peace will come over you, because you'll realize, now I can summon up my resources to really engage and take part in getting this taken care of.
Another question that I keep getting asked by patients is, why me? And they can't seem to get the correct answer. And I sometimes can't answer that either. How do you answer that question when someone says, why me, and why not someone else, and why at this point in my life? I've not done anything wrong. I've been a good person, but still this has happened to me. How do you answer that?
I always answer with a question, which you really shouldn't be doing, I know, but I'll explain to everybody why. I want know a little bit more about why they're saying why me. For example, it could be a very deep spiritual or religious idea that they have done something for which they're now being punished. That's very different from a person saying, I know I didn't eat right, or I know I haven't been the healthiest and I don't exercise. And very different from someone who says, I missed my mammogram and then I got a diagnosis. You see that, so how different that is when you're wondering why. So first I need to know a little more about where is the question why coming from. But regardless of where it comes from, once we can address that, I think it's so important to understand that even though your world is full of ideas of what you can do to help your cancer, eat this way, get rid of your stress, to have relationships like this. And I'm even going to talk about those. Even though we say that, that doesn't mean that you caused it by not being that way. You see, it's so complicated that it's nearly impossible for you to have done something or been a certain way or not done something that then caused your cancer. It really is not that black and white. So once you remove that guilt from yourself and realize that even the doctors are still studying that, they're still studying why certain people get cancer, why certain people don't. I myself am on a study for breast cancer because one of my 3 sisters had it, but the others didn't. So we're still looking into that. Once you broaden your view and realize that it's not that simple, and that you couldn't have made the biology go one way or the other, then you can start to think, instead of why, I'll accept that it is, and then I'll use all the knowledge and the ability and the help that I can. I once had a patient who actually went through a very serious, difficult cancer say to me at the end, we don't ask why if we're struck by lightning. Right? You don't think, well, why did that happen? But that's because we keep talking about cancer as if there's all these different things we should be doing not to get it. But that's really never a guarantee because we don't really even know 100% why we do. Does that make sense?
It does. It does.
Okay.
And I can see one of our breast surgeons, Dr. Huria Kazem. I think she's here on the system. Maybe we can unmute her. The reason why I want to unmute her is to be able to ask her, because Dr. Kazem, you are one of the people that actually sees patients right at the beginning of the diagnosis, because you're the one diagnosing them with breast cancer or whatever other cancer that patients are being diagnosed with. What are the issues that you think patients are facing at that point?
Oh gosh, you mean psychologically
Psychologically,
or
yes.
physical? Yeah. So yes, and hi Cynthia, nice to meet you.
Hi, nice to meet you.
So yeah, I mean, you see the whole spectrum. I was just thinking as you guys were talking that, I have had patients who were smokers who got breast cancer and then went through this incredible guilt about being a smoker. And then I've had the reverse where people are running marathons and eating organic and I don't know what, like being so healthy, and then they feel like their body let them down when they've done all the right things. And it's so hard to kind of address that, because I think at the end of the day, as much as we know how common cancer is, you still want to know why I ate this or I drank that or, I did this, you know what I mean? And that's why I have cancer, because that would just make it so easy and to accept. But it's that, when you say why me, I think people understand instinctively, look, well, why not me? There's so much cancer around, but it's more like how did I get this? And that's a hard one. You just sometimes, you just have to go, well, we're lucky in this part of the world, especially in under the umbrella of Islam, we believe everything is written or predestined. So we just go, in our religion, we say, thank God for everything. So even with cancer. So it's our easy kind of get out clause of trying to answer the more difficult questions.
Absolutely.
Can I say I appreciate your answer so much, because dealing with a number of other cultures and religions too, it seems like nearly all will have something where they do believe it's part of life. Things happen, bad things happen to good people kind of thing. You know,
Exactly.
life happens, illness happens, but it's what can it teach us? What can we do now? How can we move forward? And what blessing can there even be after going through this? And I think that if it's up to us sometimes, at least in my position, to help somebody move from wasting all that energy there. Why? What did I do? And take the energy towards what can I do now? What can I do for myself? Because it really,
Yeah.
there's so much you can do. And I think that's where I try to, shift them in the thinking.
And that is such a good way of looking at it. And I think, in the beginning, certainly when I see them in the beginning, and then when Dr. Shahina sees them for chemo or whatever, they do have, or they try to acquire that mindset. But I agree with Dr. Shahina, it's at the end. It's almost like, oh my God, what did I just go through? Because you're so busy trying to, trying to do all the things you have to do. So whether it's surgery, chemo, another chemo, and then radiation, and then trying to change my lifestyle and trying to see what have I learned out of this. And then suddenly, Shahina goes, okay, right, see you in 3 months.
Yeah, right.
Yes.
And
And
then
that's when
they're like, what just
Yeah.
happened?
Exactly.
And
I
some
think
patients say that's when it all starts. That's when all of like, because you finally stop and look at what's going on, and all of the
Exactly.
psychologies can
Exactly.
start there. Yeah.
Yes, that is the
I
hard
see
part.
there's a patient who wants to ask a question. So if
Okay.
someone could unmute Abir Safi, if you're online, I think you're still online if you want to ask your question. And so while we're trying to unmute her, again, yes, it's the post chemo, post surgery,
Mhm.
post radiation, where patients start to think, what if it comes back? I don't want to take this medication, but I'm too scared not to take this medication. And I want the best, but I don't want the side effects. At the same time, I don't want the cancer to come back. And there's just all this emotion going around. How do you get patients to deal with that? And I don't know if Abir, you're unmuted. Maybe you can
Yes,
ask.
hello, Dr. Shahina. Hi,
Yes,
can you
please
hear me?
ask your question. Yes, we can hear you. We can.
Hi, hi. Hello, Dr. Cynthia. Glad to be on this very interesting and relevant conversation. Can I call myself a survivor, Dr. Shahina? I mean,
100%, 100%, you are a survivor.
okay.
Everyone here on the forum is a survivor.
Okay, luckily I am a patient of Dr. Shahina, who I consider myself, inshallah, cured from breast cancer, and as Dr. Horia said, from a religion perspective, we believe that what is meant to happen has happened, and we are where we are. Having completed my treatment, chemotherapy, operation, radiotherapy, all together. Apparently it's a stage that I don't know how to describe right now after all what I have been through, as if I am now realizing what happened. I'm now trying to co-op and accept what happened has happened. Okay, how do I get my life back? How do I live with the fear of this thing not coming back or coming back? I truly want my life, my previous life back, and I don't seem to be able to have it right away, or maybe I'm rushing things. I'm not sure. But I'm hoping that this conversation today would help me and people like me on tips and advices how to get the life back. I mean, following all the tips for someone who is healthy, organic, as you said, trying to be on the right track, doing all the right stuff, but unfortunately not able to get life back, or yet to get the life back.
Thank you
Just
I
so
hope
much
my
for
question is
coming.
clear.
Go
absolutely.
ahead.
Yeah, just to give you some perspective here, I saw Abir today morning. She looked like a model on the Paris catwalk.
God
But when
bless
I
you.
sat and I spoke to her, she asked me the same question that she's asking you. And so I asked her to come online. She has been a trooper. And I think she missed one thing where she actually told me the chemo was not difficult compared to what it is now. I want to get my life back. How do I get my life back to normal? So Cynthia, please go ahead.
Okay, and thank you so much, Abir, for coming and for asking the question, because I know there have to be others here who feel the same way, because I do encounter this a lot. And I think what's so important is there's an underlying uncertainty that's still there, the uncertainty that was mentioned before by Dr. Shahina. What will I need to take this new medication? What will life be like now? But coupling that with what you're talking about, how do I reconnect to who I was, to what my life was? Because even when on the outside, we look and we think and we say that we're completely cured and we're going about in life again and we're doing everything we need to do, there's a piece of us internally that needs to deal with still some uncertainty, with often has a little fear with it. And I find that what helps most patients the best with that is have someone very, very trusted who can hear that. And let me just say why I put it that way. If you voice that to most people when you're finished and you look so good, especially what Dr. Sheena just described, if you voice that, they will say, well, what do you mean? I thought you were past that. I thought you were over that. That's all over. Aren't you grateful? So they aren't truly in your shoes. So you need a really trusted person to be honest about that feeling and this connection with yourself. There's something of who you used to be. It could be that you were a little more innocent about life, more fun, more light, not as worried, not as driven. There's something back there about you that I have had so many survivors way at the end tell me it wasn't until they reconnected back to that part of themselves that they felt full and whole and complete again, and truly free to live disease-free, to really focus on life and no longer on treatment, but focusing on life. So something to think about. There's something maybe in there like that, and for others here also who feel that way, because it's not just about getting through the treatment. It's beautiful and it's hard, and it's great that you can cope and make it, and you're standing and you're upright. But internally, a lot of times something else, some more work needs to be done. And I find it's typically getting a handle on uncertainty and reconnecting with yourself, some essence of who you were and really still are, just finding it again.
Bronwyn, I see your hand is up.
Hi.
Bronwyn, I want to introduce her because she's freaking amazing. She was diagnosed, I think, during COVID times, and she was one of, I think, the first few patients to use the penguin cap. Her hair never fell. She has a twin that looks exactly like her, that looked the same like her after her chemotherapy. And she taught other patients how to be brave during chemo. And
Thank
here
you.
today, and please ask your question, Bronwyn.
Thank you. So, I mean, I'm not too sure if it's a question or maybe just agreeing a little bit with what you said. As Dr. Sheena said, I'm a breast cancer survivor, 3 years. I think it's 3 years, and proudly so. But maybe I'll start with maybe what Abir mentioned was that going back to your old self, from a personal perspective, I don't look to going back because that's not who I am anymore. I do think we need to take cognizance and have that awareness that we've gone through something that's really life-changing and traumatic, right? But in anything and everything, I think we do grow stronger as individuals, right? And I don't think I would be the strong individual that I am today if I hadn't gone through what I went through. Now, why I went through it, to be honest with you personally, I never asked that because my goal was to get through it, right? And Dr. Shahina will know that also, a lot of people talk around fighting cancer. My approach when I started chemo was not to fight cancer, but to be healed from the chemo. And so when I was laying and getting chemo, for me, it was this drug and the drugs that I was on afterwards and still am on. I take them every day and they're there to heal and protect me, right? And I'm a big believer in energy, and that our thoughts become our reality. And how do you check in with your thoughts consistently, right? And I do think that that's really, really important. So I don't know if it's about having that awareness, about trying to get back to who you are, because just you're never going to be that person, right? Because you've gone through such a life-changing space, but that doesn't mean that you're not going to be someone greater, because I always think through adversity, we become greater and stronger. And how else do we help people or ourselves or our families? Number one. And I do think that when you spoke, Dr. Shahina, to around those 3 phases, those are very true, right? I do think you have that first phase, and then you're going through a treatment. And I personally felt that the post fact after my treatment was where it actually hit me, you know, and I had that little bit of that PSD. And every time I went into the hospital, even though it was every 3 months to see Dr. Shahina, I'm still like, oh, you know, or whatever it is. And you do take that breath. But when I do that, now I'm just very grateful that I'm healed, right? And then I go sit and have a nice chat, Dr. Shahina.
We talk about shopping.
We talk about shopping. But I think maybe for me, it really is around that. And it's interesting because when I was diagnosed, I was really annoyed that all the doctors kept saying to me, and even Dr. Sheena, how are you feeling? What's going on? And I was like, please don't ask me how I'm feeling and what's going on. I want to start my treatment. I want my surgery. I want this. I want that. And, you know, again, only afterwards did I also really realize it's really around your mental capacity and that mental health that you, and like Sheena said, I was in COVID, so I was doing chemo and coming home alone after chemo, right? And things like that. And so I do think there's a big mental health element to managing and going through this journey. But I call it a journey because a journey has an end, right? And there is light at the end of the tunnel, and that's how I think about it. So just to not ask a question, but maybe affirm some of the things that you are trying to convey and say.
No, thank you. I think Iman has a question, and as we're trying to unmute her, I want to ask you a question, Cindy. And that is one of the questions that Abir actually asked me today is, she's finished her chemo, she's finished her radiation therapy, she's finished her surgery. She's on endocrine therapy now. She looks fantastic. She's gone back to work, but she can't get over the fatigue. She's exercising, she's doing Pilates, she has a personal trainer that works with her, but she's still so tired. And one of the things she's asked me is how to overcome that. What do you tell your patients, Cindy? And then after that, we'll go to Iman.
Okay, so you did mention a couple of the things to check. Naturally, hydration is super important. It really is amazing how often just a little bit of a problem with hydration can go really make you feel very, very fatigued if you're just a little underhydrated. And then also with hydration, electrolytes, because when you're really hydrating well, you got to be careful to also add electrolytes. And the exercise, which she is doing, is really important as well, because the more circulation, it might be that, I don't know if she is, but if she needs to be doing something every day, like even some breathing techniques that are oxygenating her blood during the day. Now, we're obviously oxygenating our blood when we breathe, right? But these breathing techniques just give a little more concentration to that. And people do find that they feel better if they do intersperse throughout the day certain breathing techniques. After that, it kind of gets into the topic of nutrition, which I know we're doing another night, but there are certain things about the nutrition that can really help, especially greens, thinking about doing some greens drinks like juicing without the sugar, but with the greens. I see people get helped very well with that. Getting good rest and making sure it's even deep sleep. And then after that, anything that's on her mind that's nagging or replaying, tapes that are replaying or worries, they're fatiguing as well. So I think there are a number of things to try to take a look at, you know, for the fatigue. Some of the fatigue that's already counted as a side effect for the medication, it doesn't mean that you can't still help the fatigue, even though it's a natural consequence of the medication, you know. So I think sometimes we think, well, it's just the medications, that's the way it is. It doesn't have to be. You can still find ways to feel more energy.
Iman, you had a question?
Yeah, first, thank you so much for this great forum. It's really nice. I just want to echo whatever survivors, I'm a survivor, whatever they already mentioned. I echo, but when it comes to why it's me, to be honest, I never ask myself this question. I just want to go through the journey and complete it and finish it off. Also, I felt during this journey, and you know, Dr. Shahina, I had a lot of people supported me. So I felt very blessed to be a part, because sometimes you don't realize how people, they love you until you have some really serious issue.
Absolutely. Yes.
Yeah.
And I can
So,
tell you,
yeah.
Iman had some amazing friends. I couldn't believe how her friends banded around her. And they actually,
Yeah.
I used to tell off Iman for not exercising. She used to drag her butt into my clinic, and I say, "Why are you not exercising?" And her friends used to make her walk and do
Yeah.
those steps that she needed to do.
Yeah,
every
to be honest, I just came from sound healing session because they pushed me so much, and I said I'm very busy at work. They said no. I said no, I have to attend Dr. Shahina's forum. They said no, you can come between 6 and 7 and you do the session. So I feel that I'm thankful. I know it's hard to go through all this, but sometimes you don't realize how much people love you, support you until you get serious, uh, like serious illness like this. So I feel that I'm blessed, even if it's a cancer. You know, sometimes it's cancer word. It's very scary, but I feel that I'm very blessed, especially to have a lot of people around me supporting me.
Thank you.
Yeah.
That's so beautiful. I really believe in this concept that every crisis has two parts to it, the danger, right? But the opportunity, and the opportunity that you were given, that was laid right in front of you with your friends and their ability to be there for you and enhance your relationship. That's just beautiful. And that's the human part of this that's so important. And it's so beautiful to hear you talk about it. It's great to hear how they just came in, and did it. And then I'd love for everyone else here hearing this, because there are people out there who don't have that, and maybe they'll understand it's okay to accept it, and it's okay to even ask for it if they don't have it, so, or maybe there's some caregivers here who would like to be that way for a family member, and they can hear from you how important that is, because we need each other. That's a beautiful benefit, having gone through cancer. I heard a little bit in you. Sometimes we're afraid to say it's a good thing, because how could you say that it's cancer? But it is, because it has these benefits as well, which is really, it's a real blessing to have that. And we call that benefit finding. And you definitely found one. So
Yeah, and to be
yeah.
honest, during the chemo session, we turned it to be a party time because we stay at the hospital for so long. So I used to make schedule for people that to go with me. Plus,
Oh.
we used to do whatever activities we keep it during the COVID, the chemo session, and we do it. So it was a lot of fun. Even we used to take a lot of photos, poses, and all, because I want to make a journey, and I want to make I have photos from first session until the end, until number 12 session.
Oh,
and,
that's great.
and we want to make a video of it. So even if it's tough journey, we want to make it fun.
Mhm.
So
I think we have another question from Sana. I know Sana is your fan, Cindy. So,
thank you.
Sana, please, can someone unmute her so that she can ask her question? Sana.
Uh, Hello, everyone. This is Dr. Sana, and it is very nice meeting you all. And I'm I'm highly honored with such brilliant members like Dr. Shaina Rao, Dr. Cindy Collins. Like you people you are angels. Like you are discussing things like. Uh, this discussion was very important for all of us, for all, not only for ladies but also for men. And can I have Dr. Shaina Daud, can I have 5 minutes to talk, because I am also a psychologist, and I have done my diploma in mental health also. So I do have some points to discuss for our cancer patient survivors also, and for the new patients and for everyone, so that they can accept this thing that they are the bravest peoples among us. My father was a cancer patient, and he had a squamous cell carcinoma of mouth. And he was diagnosed 2 years back. And I was the only child, and I was taking care of him. I was going for his chemotherapies. I was taking care, and he expired on 6th May this year. And I saw him with a lot of difficulties and problems and depression and anxiety. And sometimes he used to scream, sometimes he used to get angry, sometimes he used to stay silent. And I was like, I am a doctor and I can't do anything for my father. And I'm seeing him like this and watching him like in such pain. I was so helpless that my father can get it. Why this was the question of mine. This was not my father's question. This was my question of why he got that damn illness, because I was the daughter of him and I can see him. So after his expiration, I realized that to all the people, I'm saying this, who survived the cancer, who are the victims, this message is for all of you that you can be a victim of cancer or a survivor of cancer. It's a mindset. And my favorite quote from by Aristotle is, "It is during our darkest moments that we must focus to see the light." So please, people, 70% cancer survivors experience depression at some point. Patient may experience generalized worry, fear of future, inability to make plans, and vulnerability, such as possible development of secondary cancers and one's roles within the community. Please don't do this to yourselves. And I really, really am with Dr. Cindy Collins. I agree with her that mindfulness-based stress reduction meditation is a type of meditation that you people can do. And it includes the simple yoga, stretching, combined breathing exercises, walking. It improves your quality of life. Every healthcare setup and hospital must have cancer care and palliative care physicians, specialists, consultants to take proper care of last stage cancer patients and to treat them accordingly. So
Thank you, Sana. I really appreciate that, what you've said so far. And Cindy, that gets us to our next part. It's not only the
Thank you.
patients who are going through the journey, right? It's also the family members that go through the journey. I mean, how do you cope? How do you, sort of counsel them on how to cope? Because I usually get family members that also come to my clinic depressed, crying, and saying that they don't know how to support. That's their biggest question. How do we support the person that's going through the journey?
And we really need to have more available for caregivers. I've just used that term, whether it's family, close friends, someone who is there wanting to give care. And so much of that begins with what the family dynamic already is. Very often there's already a way of how mothers and daughters and fathers and brothers and siblings relate to one another. And so it takes really sitting and realizing how are we with each other? What are the gifts we can give each other? And it's partly the patient's responsibility as well to let them know what you need. That becomes very important. I think more often I hear someone saying, I'm not getting the care I need. They don't really seem to understand or care about me. They're not hearing me. They're impatient with me. Or in the opposite direction, they want to do so much for me, but I really don't want it. I need to do this on my own. That is the most fundamental piece of it right there. How much do you want to have others involved? And how much of it is a time where it's because of your personality or the way that you are, that you need to have your separate time as well. There's always the practical things, making food or not, making sure household duties are done, taking care of children, things like that. But it's the other piece, it's the emotional piece where I think it's important to gather everyone together and talk at one time with a professional about how are things going. And because a lot comes out when you have a neutral person sitting in the room that otherwise may not get said or not get said in a polite way. You need a neutral person in the room to do those conversations. And my other concern is that a lot of caregivers stop caring for themselves. So the second person at risk for cancer after a patient, by the way, is their caregiver. And there's research on that too, on the rate of caregivers who become sick in some way because they stop taking care of themselves. So there's got to be a way for us to have more community support and maybe extended family support and things like that. Everything that works for a patient works for a caregiver too.
So another question that comes up frequently, and Abir has actually posted this question on the chat box, is, and all, I think, I can't remember a patient that's not asked me this question. After they've finished everything, if they get the slightest tweak in pain here or there, they think their cancer has come back. How to control that? And again, it's about how to get back to normality. A cough, cold, pre-cancer was very different to a cough, cold, post-cancer, if you know what I'm trying to say over here.
Absolutely.
Everything gets
Mhm.
blown up. And it's
Mhm.
difficult because you're trying to get back to your normal life. You're trying to be a mother to your kids. You're trying to be a wife to your husband. You're trying to go to work and be that person that you were before, maybe even
Mhm.
stronger, like Bronwyn says, get
Mhm.
stronger and stronger. But
Mhm.
that bit about everything could be the cancer coming back. How do you deal with that?
Right. And, and I agree with Robin too. Every challenge we meet, we improve. That's what our track record is. And we get better for the next challenge because life is full of challenges. So with every challenge, we evolve and we change and we have new strengths, new capabilities, new lessons we've learned, new ways of looking at life, and then we keep going. And I think that one thing that might be helpful in this aspect is realizing that you have changed, things have changed, but at this point, it's more about perspective in a way, I think, because it's not really getting back to the normal before. And I'm not a big fan of new normal because I think it's a fad term, but it's getting to your life as you need and want it to be. And a lot of patients have a whole new list of priorities when it comes to that, right? So I think that's the first thing to look at, is that I may be listing my priorities differently, even what's really important to me. I might not think keeping my house spotless is as important as having time with my neighbor who needs a moment to talk and sit and have tea. There are things like that. We start to change our priorities. But I think it's very important to know that afterwards, your senses are heightened and your perspective is heightened. What I mean by that is you do feel a cold more, you feel a sore throat more in a way, because now it's like, uh-oh, what is that? Even pain in the area of surgery. If there's still a twinge of pain, or if you feel like I don't feel quite right today, they're concerning because our senses are heightened. Our perspective is heightened because we immediately can't help but think of cancer because we've been there. And as a patient said to me the other day, I would say to myself that the chances are so low, but they were low then too. So how can I say that now? Why am I thinking of cancer? Because you don't know. It's the unknown. It's that uncertainty again that we're going to deal with for the rest of our lives, honestly. And I think what's really important then is to stop, reassess, in the sense of knowing objectively, I am heightened in my senses and my perspective. I'm certainly a little more worried or concerned or vigilant maybe than I used to be. And if you really are concerned, go see the doctor. I really think that if you think something's happening, you should check that out. Because why wouldn't you now check it out? I don't know if the healthcare system there can accommodate that much of an influx, but I think it's important, that you check it out rather than sit on it and worry. I don't think dismissing it or saying that it's probably nothing, it's just a headache. I always used to get headaches. I don't think that's wise either. I think listening to your body, learning this new awareness of your body that you have after going through treatment, and then utilizing that to make a sound decision. And if you think you're really overdoing it, if something in your mind says, I'm just over worrying, ask again a trusted individual. The most trusted person for that would be your doctor, of course, who knows you medically. But also at home, you might ask a trusted individual, do you think I'm complaining of this too much? And get an outside opinion. But get it checked out if you're concerned.
No, absolutely. I always tell patients, if you are worried, please come in. I also tell them that it's important to get also a GP or a family physician that can deal with the everyday nuances of a normal human being, you know, as tough, cold, that that needs to be taken care of as well. There are two issues that I also wanted to bring up, and I please, like I said, everyone, put up your hands, ask your questions. This is your opportunity to be able to speak to Cindy one-on-one. One is sleep. Patients, once they've gone through the journey, it's so difficult for them to get back into the normal habit of sleeping at night. They almost, I would say 90% of my patients will tell me they find it very difficult to sleep. How do you deal with that?
So for years, how many now? 37. I'm gathering all the things that work for sleep. Obviously, there's the medical, right? Then there's the herbal. Then there's the behaviors that we have research on, but I'm gathering from other people all the time. When I have a patient who finally says, I slept, how'd you do it? What worked? Because we're so individualized in this. I find that it's amazing how sometimes it's a matter of getting to sleep. Other times it's waking after you're asleep. Then it's how many times you wake. Then it's, can I get back to sleep after waking? And some people seem to have a reset, like they fall asleep maybe even in the early morning hours, but they get their best sleep in those 4 or 5 hours and feel refreshed. After that, the whole question of napping or not comes in, right? So the variability on this is probably the most overwhelming part of answering this question and helping a patient. So I have to go down to this in an individualized way with every single patient. How did you used to sleep? When did the sleep issue happen? Maybe there's something else physical even that's keeping you from sleeping. Now, if I were to say what I see things working the most, getting worries off your mind is number one if you want to talk about psychology. Sometimes it's a matter of taking, and I would have to say, I'm going to show you one here, a small piece of paper and writing the things that are running through your mind right there. Why do I say small? Because it doesn't look as bad and overwhelming if you can fit it on here versus a big piece of paper, because many of us are carrying these things in our mind. We're expecting ourselves to go to sleep. We're expecting ourselves to wake up and not have something right on our mind right away that we're concerned about. Does putting them on the paper resolve them? No, but it puts them somewhere else. It gets them off your mind on the paper. That little trick is working so well for so many people. And then they know the next day they can look at it and see what the worries were. Don't worry, they're not going away. They're still right there. Another thing that works beautifully is, again, back to what Sana mentioned, mindfulness meditation. And I'm doing a lot of deeper body relaxation with breathing techniques and mindfulness meditation that is helping people who have gone months without any significant sleep. I myself have been amazed at how once the body learns it, and it literally shifts your body from its sympathetic, high arousal side over to the parasympathetic, low arousal, content side. It shifts you neurologically, but your body starts to learn to do it on its own after it's practiced over a period of time. And then you yourself can sleep beautifully because your body is ready to do it. There are a lot of really cool apps out there. One of my favorite has to do with reading sleep stories. And sometimes someone's voice is so relaxing and they drone on with the details of a sleep story. But don't think that that's not science, because the science shows us when your mind can attend to something that's not necessarily you need to remember it, it's just nice to hear, it actually can control that busier side of your mind. It'll start shutting down. Some people, probably at least 2 or 3 in here, have said they play a radio or have an extraneous noise, and that helps them to focus here. That's why when you occupy your mind that way, your busier part will shut down and quiet down. So there are a lot of tricks like that. But I think once you know you've got caffeine out of the diet, you know, your diet under control, extraneous pain that you might have, the temperature in your room, all the physiological things taken care of, get these worries off your mind, and then also do some breathing to get your body into a better place to sleep.
So the other question that I wanted to ask, and this is just from observation of what I see of patients' journeys, and that is getting back not only to normality, but rebuilding, because I feel like during their chemo journey, they connect with their support system, but relationships can sometimes fall apart afterwards. So
Mhm.
how do you maintain those relationships? Relationship between a husband and a wife, between your kids, when I mean, a mother and their children, because you're giving them endocrine therapy and their moods are all over the place. With
Mhm.
their loved ones, even work relationships. I sometimes feel that that is falling apart post the treatment. How do you
Mhm.
maintain it? Or
Mhm.
what tools can you think about in terms of trying to maintain it?
Thank you so much for mentioning that, because that is it's a very hard thing for people to talk about because it feels so negative and like it shouldn't be happening. And I think one of the reasons why we think it shouldn't be happening is that, first of all, our image of ourselves is that we're a likable and capable person and we did the best we could, and now we think things should be fine. And that's true. But the other piece is people were going out of their way to be extra nice sometimes and accommodate things, especially hormonal shifts and then our behaviors that come from that, or just when we didn't feel well, or we let them down because we couldn't be there, or who knows, the myriad of things that have built up, during that time, like you're saying. And sometimes it's even a little subtle behind the scenes of something I call a taboo. Sometimes people will see you as a victim and they're being extra nice to you in that way. But then when you're finished with treatment, it's still this kind of taboo of a person who had cancer. And to think we still have that in our societies these days is really hard to understand, but we do. We still have people who shy away from someone who has had cancer, or shy away from, they don't know what to say, they're uncomfortable if they've lost weight or they look different or they were different in their behavior, no longer our chum that goes out after work, and just having fun. Things like that can change. So I call all of that a loss. And I feel like there are losses as well that occur during treatment. Some of it has to do with how you see yourself. Some is like your relationships, like you're saying. The regaining can absolutely be done. And the best way, I think, to think of how you regain is know who you are and establishing relationships in the first place. And that's what I mean by reconnecting to the essence of yourself. You are a person who has had friendships. You're a person who's had beautiful relationships with siblings, with parents, with your spouse. All of that had its essence and can again have it. It's a matter of renewing and repairing. So sometimes simply asking for forgiveness. So much goes unsaid that is so much better said. Just say, I just want to let you know, whatever all of these weeks, months, thank you so much. Please forgive me for any time I wasn't there for you. I know I've changed because I've gone through an experience where I've changed so much. I hope that we're changing together. And I'd like to know from you if there's any way that I can make you understand me better or differently, or what are you missing from our relationship? What have you been missing? Is it our quiet time together? Are you missing the intimacy? Are you missing the fact that we didn't always talk about cancer and then it seemed like now we're always talking about cancer? There's so many ways that we need to let the other person in the relationship voice what they feel they have lost as well. But loss is only stimulus for regain. That's all loss is. Loss is just recognizing something was, maybe is not now, and can be regained. If you didn't recognize the loss, then you wouldn't have any opportunity now to fix it, to repair it and restore it. So the restoration part, like you mentioned early on again, that restoration afterwards really is when it all begins. It's really when more of the major work gets done, I think. So.
No, thank you. I think that's so important because we see it all the time and then people just don't know how to get back in. I say it's getting back into the groove of things, both in your life as well as your personal life. Now, one of the last questions I want to ask, and like I said, this is your opportunity, everyone. Put your hands up or post your questions online. We have a couple of more minutes before we are at the top of the hour, and then we'll have to let Cindy go and hopefully get her back on another webinar where we'll be able to ask more questions. But one of the questions I wanted to ask is, what are the holistic tools that people can, or patients and everyone can use? And you can see Bronwyn has actually put up acupuncture. I'm a trained acupuncturist, but she was my guru in inspiring me to tell people to do acupuncture. How do these holistic tools, how can you incorporate it into your cancer journey to help you?
That's such a great winding up question. I'm so happy in this field for those of you who may not be aware, we've moved away from the fear of these holistic things because we used to call them alternative, which meant you were doing it instead of the treatment. So that's never necessary nor a good thing to do. And thank goodness over the years now, we've learned to call them complementary, and we've learned how to have them available and safe while on treatment. So even when it comes down to something as simple as herbs, let's just go there first. It is very important to make sure you check out any herbal preparations, even teas that you're using, that they do not interfere with your chemotherapy. And I have a couple of different sites that I go to scientifically check that out. That's very important, but there are a lot. For example, ginger is an amazing spice that helps with nausea. And then chamomile is a beautiful spice for relaxation. And I could go on with many, many more. So having things like that are very important. Other holistic approaches have to do with other physical things like acupuncture. I'm definitely promote acupuncture with my patients, even massage, the right kind of massage. You can sometimes find practitioners who have enough experience with cancer patients in massage. They're much better at facilitating the kind of relaxation that you need without injuring tissue and being very careful about, what they do as far as not to heat up the body too much and things like that. Another is what I call meditative movement. So holistically, Qigong, which I offer a Qigong every Wednesday for free like this by Zoom at 5 p.m. our time. So I don't know if that would work for you, but I think Qigong, which is just like Tai Chi, which is a lot like what we do in yoga, right? A lot of these begin to have a parallel. What you're doing is, again, you're breathing with movement. So when you have the natural, slow, concentrated, intentional breath, increasing oxygenation and getting a certain neurotransmitters flowing through your body along with the circulation, I think it's extremely important. I even house under holistic tea with a friend. So typically I have a tea slide because I just think that we need to stop and stop. We need to just stop the day, stop and be, stop and contemplate, stop and share a moment, even in silence with someone. And drinking a cup of tea is a great way to do that. Nature is another very important holistic. Nature means more to some people. We don't all connect that much with nature, but that's another holistic thing that you can do. Sound bath was mentioned here. There's some amazing progression being done with music therapy, sound bath, other energy sources like that. I think they're very important. And as long as my caveat is, as long as nothing is harmful, as long as it can't do harm, and you check that out, whether it's a physical or chemical thing versus an experience that cannot do harm, then how could it hurt you? If your belief system buys into that, if you believe that this is good for you, I think it's important to follow your heart on that. I think it's really important.
2 questions before we wind up. One is a question that's come in on the post, and I have to ask it because this is a question a lot of women ask. How to accept that you've lost a part of your body after mastectomy? That's number 1. And as you're answering that, I'm going to ask the team to unmute Heidi so that she's able to ask her question as well. So Cindy, about the mastectomy question, and then we unmute.
Yes, thank you for bringing up such a direct and important question. So when you are experiencing loss of a part of your body, and I use the word experience, not when you've had it. Some women aren't really feeling the experience as much as others. For some, it's a physiological thing. It didn't have that deep feeling for them. When you are feeling the loss, you must first examine the loss. You really need to think to yourself, why is this so important? What did this mean to me? What does it mean about who I am? How I see myself? I believe our self-image is so paramount, not even just how others see us yet. We're not going there yet. How do I see myself? Do I see myself as less feminine? Do I see myself as less of a mother or a woman or whatever the essence of who you believe you are? Have you looked at yourself in the mirror? Are you seeing yourself and completely accepting your whole of who you are? Because that's just a piece of you that is gone now, are you able to say that the whole of me is here and move forward in that direction? A lot of this has to do with self-talk. Talking to yourself, ask yourself, why does it pain me? Why does it bother me? Why is it causing me sadness to feel this way? And then really explore that with yourself, with someone who, again, if you have someone, another woman especially, that you really trust, it's a good idea, or someone who's been through it. But don't ever expect anyone's experience to be exactly yours. It's yours as individual. And then talk to yourself about how much you love yourself. You are your biggest fan. You are your biggest supporter. You love and support who you are, your journey in this world, your purpose here. This has become part of the fate of what you've had to deal with, but you're here. And so you might even need to talk to yourself. Hey, self, I think you're beautiful. I love you. You're still the same. I still see you being the wonderful mommy, daughter, friend, sister, whatever that you are. I still think you look beautiful in clothing that you're wearing. You may need to actually talk to yourself that way. If it feels funny at first, then that just means you're normal because it does feel funny at first, but we talk to ourselves all the time in the other way, like, oh, why did I say that, right? So why not talk to ourselves in that way? I think it's very important.
Heidi, you put your
Okay,
hand up.
so yeah, so first, thank you so much, Dr. Shahina and Dr. Cindy. Maybe I don't have the privilege to attend from the beginning. However, I really enjoyed the questions and the answers. My question actually is regarding the menopause side effects for tamoxifen and the Zoladex, which is I really appreciate, and I'm really grateful that this is something Dr. Shahina is giving to us to protect us from, after I'm a breast cancer survivor now, after having I finished my chemo last December in Christmas, Christmas, which is I'm really grateful for that, grateful for Dr. Shahina. However, and I really listen about, yes, we have to accept ourselves after this. We are not like before, but I'm really obsessed with weight gain. I gained 12 kilos during chemo. I get them down, and then I lost some weight, and then now I'm gaining it, the visceral fats. I feel a little bit, I don't want to say demotivated, but I'm not confident, to be honest. Now I'm working. I'm facing a lot of my colleagues, my friends. My clothes is not fitting me like before. My body looks changed. I'm 41 years old, and I look I know I look younger than this, which is I'm happy and grateful for, as I mentioned. However, I feel inside like I'm 50s or 60s, which is makes me feel like I cannot lose my weight. I start to also to have some, going sports and all of this. Unfortunately, I cannot lose it very, very easy like before. So, any thoughts about this?
Definitely. And this might, when we do the nutrition, we'll have to talk to Dr. Shaheen about that. We may actually have a big piece of that about the weight, because the weight is such an important part. So I'm listening to everything you're saying, and I'm so glad that I hear self-acceptance, but that you also would really rather be different. Like you accept that this is what's happening. I need to do this. This is keeping me healthy. This is important. But I'd rather what I look like, the form, the shape, the weight would be different. Now, so far, what you have done has not worked. So the I can't is not yet completely true. Okay. And I'm saying that only because I've worked for so many years with women where it wasn't working, but we did find a way. A lot of what's happened with your body is that metabolic rate has reset. And when our estrogen is lowered, especially lowered as much as with the treatments that you're continually taking, you're resetting everything that's going on with burning your calories and how you make muscle versus fat, a lot of these things. So it will take longer, but it can be done, and it has to be done in a stepwise fashion. It has a lot to do with movement, like you said, exercising, the right kind. With the eating, you might be eating exactly how you should as far as what you eat. We might need to change the when you eat what you eat. Sometimes that has to do with it. There are ways to decrease this weight and also to get back to the shape that makes you comfortable. I love that you shared with us, and thank you for being brave enough to share that internally it's giving you this idea that you're older than you are, and that's what I mean by self-image. So the way you said it describes that beautifully. That is what that is when on the inside you're seeing yourself in a certain way, and it matters. So all of the self-care, all of the self-support you can give yourself, just like you would do if you were coaching a friend of yours to finally make their goal. You've got to start doing that for yourself, and even in a visible way, like get a whiteboard where you put the dates, what you did, check it off, everything you did, that you ate right, you moved, etc. And there are other ways we can start to increase your metabolism and get your body to stop storing your calories and instead utilize them. Okay, so it would take a little more discussion with you to really get into what would work specifically for you. But the fact that you said I'm beginning to lose motivation, this is the perfect time for you to talk about it, because when you lose motivation, then you've stopped, right? And we want you to keep the motivation. Trust me, you can do it.
I can tell you, I will not let her lose her motivation. Heidi, I will give you Cindy's email address, connect with her, and maybe you can then offline in another session talk about how to lose weight, because there's no a way that I'm going to let you lose motivation, at least as far as I'm your physician. As a final, I want our male survivor, Ayub, he's put his hand up. I want him to talk because we have actually quite a few male survivors over here. And I just want to say, Cindy, actually Ayub is my inspiration. He sends me videos of himself carrying weights while he's taking his chemotherapy. And he's actually built a six-pack while he's getting his chemotherapy.
Wow,
So I
that's
want
inspiring.
you to talk, and please, let us know your thoughts, Ayub.
Thank you very much. Well, basically my question is how to deal with the change in the physical appearance. You stand up front of the mirror, you lost hair, you lost muscle, you gain weight, you lost weight. How to deal with that? It's like looking at the mirror, this is not me. The second question is, one day fully energetic, next day fatigue, heavy legs, especially legs, heavy legs, how to deal with that. And finally and thirdly, if there is any new scientific research study that you can share with us like that about the subject. And thank you.
Okay, so and first of all, congratulations on the six-pack. That's amazing. But also, you brought up something so important. A lot of patients aren't sure if they can exercise while on treatment. And that's a very fine balance, isn't it? Because you don't want to deplete your energy to the point where you can't cope with any side effects. And you also wouldn't want to do forms of exercise that might even decrease your immune system, which they are out there. So I love the fact that you apparently found a balance where you could exercise during treatment, and you did. And it's very inspiring, because I am a firm believer in that. As long as you're disciplined enough to do the right amount and listen to your body, when you need rest, you need rest. When you need exercise. I have met so many male cancer patients, especially, who were able to maintain their muscle mass and decrease their fat composition, which is what you're referring to. And it has to do with looking at the amount of the macronutrients, the fat, carbon, protein being put into the system, and whether they're being utilized, because all three of those can move toward fat production. And you're not necessarily promoting more muscle production. It all depends on when you exercise as to when you ate and how much protein you're putting into the system as well. We're learning so much more about that. And we're even learning a little bit about some of this intermittent fasting used in a correct way that can help open those windows to deplete. This is off treatment, of course, but open those windows to deplete some of the fat production and increase more enhancement of the muscle building. So there's new information looking at that. All the way back to the first thing you said, what do you do when you're looking in the mirror? It's the eternal optimist. It's the hope. It's the fact that you have overcome other barriers in the past. You've overcome other challenges in the past. And the more you work on this, you will find a way. And also knowing there's a lot of research out there right now, not only looking at how good exercise is simply for cancer remission. It's amazing how strong of an influence exercise has on putting a patient into remission and keeping them here, especially breast cancer, by the way, keeping them in remission. It's a very, very powerful factor. So regardless of the body shape, your exercise in itself is already achieving something very important. And after that, finding a way to kind of tweak it so that we can, get these other issues cared for as well.
So thank you very much. I know I've taken 10 more minutes of your time, Cindy. I
I don't
apologize
know.
for that, but it's been fun. I know there's so many other questions that are coming in. I promise you we will have another session whenever I'm able to pull Cindy out and come on to another webinar for us. She's also an expert in cancer nutrition. We're hoping to have a session for that. And just to inform everyone, in October, we're going to have an in-person session with a breast cancer coach who's going to come in and actually talk to the breast cancer survivors here. So this is just the beginning of the patient advocacy series, and it's all for you. Thank you all for being the amazing human beings that you are. I know that I learn something new from every single one of you every day. And thank you, Cindy, for being awesome and giving us the tools that we need, not only for patients, but also for physicians like myself to be able to help the patients that are here on the forum today. So thank you all, and hope to see you at the next session of the Patient Advocacy Series. Thank you.
Thank you so much, everyone. Thank you, Sheena.
Thank you.